Hello everyone, welcome to my YouTube channel MedBuddy. Please subscribe the channel and continue listening to Duchenne's muscular dystrophy. Duchenne's muscular dystrophy is most common hereditary muscular dystrophy. This is inherited in form of X-linked recessive. So if mother is carrier of the disease, then she will affect the male child. She will not affect the female child, and the disease present only in male does not affect the female. Okay. Onset of the disease is usually 5 years. What is the pathogenesis of the disease? On X chromosome, there is a gene known as dystrophin gene. This dystrophin gene, one point you have to remember is dystrophin is the largest gene of our body. Deletion of XP21 lead to deletion of dystrophin gene. So there will be no dystrophin, which is a subsarcolemmal protein. So deficiency of dystrophin lead to muscle necrosis and atrophy. So thereby leading to muscle weakness. Usually 5 to 6 year old child present with proximal lower limb muscle weakness, present as frequent falls, waddling gait and mental retardation. We will learn this with the help of this diagram. So this is little 2-year-old child who is having no or very minimal symptom. The symptoms start appearing at the age of 5 years and then progress till 15 to 20 years, and usually Duchenne's muscular dystrophy patient die by 25 years of age. At 8 years of age, patient present with weakness mainly of pelvic girdle region. There will be marked lordosis. By the age of 15 years, child become wheelchair bound and there will be severe crippling deformities and contracture formation. At the age of 18 to 20 years, patient usually die due to recurrent pulmonary infections. So most common cause of death in Duchenne's muscular dystrophy is recurrent pulmonary infection. So regarding the pathogenesis and clinical feature of the disease, we studied that this is X-linked XP21 gene deletion, due to which there is absence of dystrophin. Dystrophin protein is present in the subsarcolemmal membrane of the muscles. So there will be muscle fiber damage. Subsarcolemmal protein is present in cardiac muscle, smooth muscle as well as skeletal muscle. So there is involvement of all of these three, that is cardiac, smooth and skeletal muscle. In case of cardiac muscle, it will lead to dilated cardiomyopathy and conduction abnormalities. Smooth muscle affected are of GIT region and it lead to constipation. In case of skeletal muscle, the patient usually is having proximal lower limb and upper limb weakness with atrophy of the muscles. Respiratory muscle can also involve, and there will be respiratory muscle weakness leading to recurrent pulmonary infection, and due to dilated cardiomyopathy, often CHF will be there and patient will die by the age of 25 years. So important age to remember is 5 to 6 years when patient have toe walking with heel cord contracture, proximal lower limb weakness start, and when patient have to stand from the sitting position, then there will be Gover sign. He will stand up with the help of hands. So to explain the Gover, so this is the Gover sign. Characteristically, when patient stand up from the prone position, he put his hand successively on floor, then on knee. So first on floor, then on knee, and then on thighs, and then he will stand up. And when he stand, then lumbar lordosis will appear. When patient is in sitting position, lumbar lordosis disappear. So next is by 15 years, patient will be wheelchair bound. And by around 18 to 20 years, patient will start having recurrent pulmonary infection and CHF, and by the age of 25 years, death usually occurs. So one more characteristic feature of Duchenne's muscular dystrophy is calf muscle hypertrophy. But this is actually not the muscle hypertrophy, this is pseudo hypertrophy, as there is increased collagen deposition, not actually the muscle fibers. Actually, muscle fiber are getting necrosed and there is increased collagen deposition leading to pseudo hypertrophy of the muscle and with heel contracture. One more sign related to Duchenne's muscular dystrophy is valley sign. So we will look into. So this is the valley sign. Valley sign. Now what is this valley sign? This posterior axillary fold, this is atrophied, and this muscle, that is deltoid muscle and supraspinatus muscle, they are getting pseudo hypertrophied, due to which this is appearing like a valley is formed. Here supraspinatus muscle hypertrophy is there, here deltoid muscle hypertrophy is there, and posterior axillary fold is atrophied. So this look like a valley. So this is known as valley sign. So important associations we saw in Duchenne's muscular dystrophy is, first is cardiomyopathy. Okay, and cardiomyopathy is DCMP and conduction abnormality. These are cardiac manifestation. Then scoliosis, lumbar lordosis. Mental retardation can be there. Mental retardation is usually mild. Okay, and pseudo hypertrophy seen in pseudo hypertrophy once due to collagen deposition. It is seen in, most common is gastrocnemius muscle, that is calf hypertrophy. Okay, and second is deltoid and infraspinatus, which is leading on to valley sign. Deltoid and infraspinatus. One important sign is Gower sign. Another important sign is valley sign. So this is all about the Duchenne's muscular dystrophy. Now we will come to the Becker's muscular dystrophy. Becker's muscular dystrophy is similar to Duchenne's muscular dystrophy, and there is same dystrophin gene mutation, but here it is not complete absence of dystrophin, there is mild decrease in dystrophin protein. So there are mild symptoms. Usual presentation of disease is they can survive up to 4th decade. There will be no mental retardation. So the differentiating features from Duchenne's are, there will be no mental retardation. There will be no contractures as are formed in Duchenne's muscular dystrophy. There most common cause of death was recurrent pulmonary infection. Here most common cause of death is cardiomyopathy. There is no treatment of Duchenne's muscular dystrophy as such, but steroid works better in Becker's than Duchenne's. Okay, they can survive up to 4th to 5th decade. So this is all about Duchenne's and Becker's muscular dystrophy. In next video, we will discuss about congenital dystrophies. So thank you very much. Please like my channel and subscribe my channel.